Right, so we brought you a story about the striking Doctors Association, Resident Doctors Association in Nigeria, and the new court order by the justice. To really bring more context into this, we're joined by our guest, who is also a public health specialist, Dr. Tuyi Mebawondu. Dr. Tuyi, good morning. Welcome to the program, Breakfast Central.
Good morning.
Good morning, Dr. Tuyi. Now, the union, after a meeting they had with the Labour Minister, stated that it would proceed with a case at the National Industrial Court, NIC. But now the court has ordered that the strike be suspended with immediate effect. Where does this even leave NARD?
I expect the medical doctors, being respectable citizens, to obey court orders. We cannot solve chaos with chaos. But what is important is this. What you cannot obtain by respect, what you cannot obtain by being sincere and being truthful and being honest and being honorable, you will get it by court order. It's nice for government to say, okay, we're going to go to court and try to push some things. But again, what kind of victory is that? There are critical issues that are under discussion here. There are critical issues that are under discussion. And the issue is simply that government should honor their agreement. That's the simple thing. And if at the end of the day, the doctors go back to work, which I expect them to do, because it is an order of the court, government should be able to stand up and then use this to redeem their name and ensure that the whole process, the whole agreement is properly put in context and honored.
Right, Dr. Tuyi. Now, during the meeting, the minister said that they had reached agreements the previous night on all the 12 disputed issues and angles, adding that implementation will start from yesterday, August 23rd. So why isn't the association willing to work with the federal government from this point?
For more than 10 years, we've had this. Government saying that their agreement they're going to implement, okay? For more than 10 years. The last time, last year, about 4 strikes. This year, the second one ongoing, all despite the fact that the ministers, not ministers, both health and labor, the House of Reps speakers, the committee chairman of health in Senate, and the committee chairman of health in House of Reps, all of them sat down and signed an agreement. And then still they go back and violate those agreements and refuse to honor the terms of those agreements. So now it's like once bitten, twice shy. If you explain that regularly, what do you expect people to do this time around? To just wake up and believe you? Well, what we're witnessing is that the health system is missing a critical endorsement from those people that are ruling us, because what you see now in Nigeria is that the political leadership, everybody, the religious leadership, all of them, this structure in Nigeria would never patronize public health in this country. They have their own health system outside the country. So in that way, they are not affected, they are not concerned. So if you go on strike or whatever, they will talk with you, they will pamper you and do nothing. And the second, what that does to the health system is that it weakens the health system. It makes people lose confidence in the health system. And then even the consumers of health, like you and I, we're not demanding our health. We're not pushing for legislation that will ensure that the health will be something to be, everybody will be proud of. So, in a way, despite the court order, despite the big part, what we're going to see is still more of the fact that we're not going to get health. Clearly, this health system we're practicing is not working. It's not working.
Right. Now, this health system we're practicing is not working. Now, even though the government has given their word that these monies will be paid, NARD and a lot of other people do not believe that these monies will be paid. But let's talk about industrial action now. We know that the problem has always been there, but it is the solution that seem not to be as effective, because this is not the first industrial action that we're having. This might not even be the last industrial action that we will have when it comes to this talk between the government and the Association of Resident Doctors. What other approach is best effective when it comes to making sure that the government keeps to their word when MOUs like this are brought upon the table?
Now, for me, I had actually suggested that what doctors should do is this. When a government signs an MOU with you or with your association, and it's okay, this is the signature. What I'll probably do is to take that MOU to a competent court of jurisdiction and get it registered and signed as a court judgment. Okay? Because you are dealing with people that don't just really give a damn whether you're alive or not. I'll push first and foremost for that, so that we can get honor. I have to actually mobilize the public behind me in fighting for what is to be essential need of Nigerians. Health is so basic. Health is the foundation of every public good. Health is connected to our civilization. If you saw what health did to the world economy, health did to the world economy, and even the whole world had to lock down. Why will we help? And look at Nigeria, maternal mortality 800 per 100,000, about the highest in the world. Okay, infant mortality, life expectancy 53 years. Infant mortality, we have 600 over, 10,000, very, very, very high. Cholera is ravaging us. Nobody just give a damn. And doctors will just have barely 50,000 registered. Half of them are the National Association of Resident Doctors, and they're not working. So we see, honestly, that our health does not concern this government. And there's nobody that will go through life without having to experience health visitation or health challenge that needs attention of health workers. And this is what we pay blind eyes to. And then we allow this to continue. Everybody just sits down back and feel that, well, it's the doctor's problem. Yes, it's the doctor's problem, but to come back to health everybody. And we look at it, the universities are on strike. Currently, you cannot train doctors. The capacity to train doctors is challenged. The 30,000 primary healthcare centers all over the nation is not working. Only 6,000 of them are working, just less than 6,000 people. And then we're just playing, we're just...
It is quite, Dr. Tuyi, Dr. Tuyi, is quite a really sad situation, the standoff between this Association of Resident Doctors and the government. But thank you so much for your time, Dr. Tuyi Mebawondu, Public Health Specialist, for coming on Breakfast Central to give us more light on the situation. Thank you once again.
Right.